chronic groin pain can come from multiple systems. It can be from your muscles, it can be from nerves, it can be from your pelvic floor. There are multiple systems. So focusing on the wrong system would be a big waste of time. What we want to understand is, what is the source of this chronic groin pain? Common causes of chronic groin pain are pelvic instability. I'm going to get into this a little bit more. You can have pelvic floor overactivity leading to that. You can have dysfunctional hip joint that is leading into it, or you can have nerve irritation that is causing it. Here is a pelvis that has a spine attached to it at the top and lower extremities attached to it at the bottom. There are nerves that exit from the spine that go through the inside and come out in the front. When there is instability of the pelvis itself, which has 3 joints by itself with the connection to the spine and the 2 down here, you end up with 3, 4, 5, and 6 different joints. Every single thing that's attached to it can be unstable, at which point it will impact the stability of the pelvis, and that means pelvic floor dysfunction. So let's explain this a little bit more. Let's say there are nerves that come from back here, and because of instability there, you will irritate those nerves. So that's the origin of the exit before it goes to the pelvis. Let's say that's not the case, but the muscles on the inside of your pelvis are now being irritated. So let me explain that, and let's put that thing aside for a second. When your pelvis is stable, the muscles on the inside react with the outside surrounding to stabilize the pelvis. The reason that's so important is because your pelvis is the foundation to the structures above. Without proper foundation, the structure above is altered, is compromised. You are the structure above. Without your upper and lower extremities, you're disabled. Without this structure, you can't exist. So instability of this is going to cause a lot more issues than you realize. So the double reinforcement of muscles inside with the outside is because this stability is so important. When stability on the outside environment is not happening, the inside has to compensate for it. It becomes tighter, it becomes dysfunctional. It's trying to provide what's not happening on the outside. When the same nerves that exited here, as they go through inside, go through these muscles, through up and down these tortuous path, going through small holes, coming out, etc., etc. When the muscles on the inside are tight, where these nerves go through, the path becomes harder. The chances of compression of these nerves increases. This circle right here, where they're residents in, including the nerves, can get smushed, compressed. So now that's the nerve input from pelvic instability causing to groin pain. When the pelvis is unstable, the lower extremities attached to it, to the socket, it's a ball and socket joint. Your hip joints are ball and socket joint. Socket is provided by the pelvis, the ball is provided by your lower extremity. When your pelvis is unstable, it can be tilted down or up, it can rotate, it can side bend. Bottom line here is that the joint is no longer centrated. So the ball no longer can freely move and have a nice fluid movement. It's very easy for the ball to scrape the socket, causing dysfunctional presentations like labral tear. That can cause groin pain. So now we're going to go over to the different presentations, all of which stem from pelvic instability. So then, how do you fix pelvic instability? And how do you know which one of these is the cause? So let's say it's a nerve thing that's causing it. Does it matter? Do you go after the nerve, or do you go after what irritated the nerve? You can go after the nerve. You can, I don't know, give yourself a nerve block. You can get Botox, which I've done videos on why I'm so against Botox. If you haven't subscribed to the channel, make sure you do, because I've tried to explore the different things that lead to this pelvic floor dysfunction. So if you haven't subscribed, make sure you do. Turn on the notification bell on, because it does make a difference. It's all about you understanding how to navigate your path, because certainly providers, you know, every part of your body is cut into pieces, given to a provider, and no provider talks to each other. That's the bottom line. And pelvic floor dysfunction is a great example of disintegration of a series of things that are happening, all of which stem from pelvic instability. So of course you can have nerve conditions like neurological disorders that impact your nerve, but the same conditions also impact your pelvic stability, which can now double up on irritation of the nerve. So you want to give your body environment it needs to thrive. Your body parts want to serve you. Provide the environment that allows them to show you what they're capable of. So you want to go after pelvic instability, and you do developmental exercises to bring stability here. That means you don't stretch. That means you don't strengthen, because stretching does not answer why it became tight. Strengthening does not answer why it became weak. What you want to do is work on proper mechanics, because that is an absolute requirement before you have a chance to strengthen and have a proper muscle tone. So what are developmental exercises? Developmental exercises are the same series of movement patterns that every walking human being on the planet Earth has followed. You're born as a baby, you can barely hold your head up. Somehow you knew exactly what patterns of movement to follow to then end up with stability. So much so that you were able to walk and then run. So that's the manual of movement. You just need to become a master of understanding what that is. I know it's not easy. I know you wish that was not the case, but the reality is you probably know more about the phone features that you have than your body's functionality and mobility. You need to understand what right is, what your default version is, what can lead to the default, so you stop doing them, and how to turn your default wrongs into right. Is it possible? Absolutely yes. The sooner you do it, the better off you are. Pelvic floor dysfunction is pelvic instability showing up in so many different shapes and forms. Groin pain being one of them. There are exercises to do. If you have subscribed to the channel, you know exactly what they are. And if you haven't, make sure you do. I'm going to show you one exercise, and at the end of this video, I'm going to put another exercise, which is, that exercise is also important in bringing stability into the picture. At this juncture, I can provide you the videos and the exercises, but you don't know what's what. So invest in learning how that is, and that 99% of the times, and I say 99 just because I don't know, I don't have the numbers. All I can say is some problems you just don't know how to solve. So invest in learning how to see things, how to put things in order, and then you apply that going forward. That means don't be a patient, be an apprentice. Find an office that's willing to transfer the knowledge to you, supervising you to make sure you understand, and then you repeat it on your own. That's how you own the solution. So back to the exercise that I'm going to do. This is the name I have for it. It's kind of nerdy, but I'm going to explain. For one, you need to breathe biologically. I'm going to make sure we have a video of that at the end of this channel. So there's certain requirements that have to be in place. If you were a patient at my office, or if you and I were interacting virtually, I would tell you the exact order of what needs to be in place first, and make sure you understand it and you duplicate it, then you do it on your own. If you memorize things, you'll forget. If you understand, you own the knowledge. So this exercise is a seated, supported hip internal external rotation. Quite a long name, but let me explain. I'm going to show you the side view first. So you're pushing the ground away. You're not sticking your chest out. You're just upright, with the diaphragms being in the right place, the abdominal and pelvic diaphragm. This is there's advanced knowledge in what I just said. So explore my YouTube channel to see exactly what that means. You push the ground away and you elongate your body. Elongation means you do not arch your back. You're sitting with your ankles farther away from each other than your knees, than your hips. Your feet are flat on the ground. So if this much distance between my butt and my feet is going to make your feet not be flat, bring them closer. So I'm just going to go to where I can be. I'm pushing the ground away and I'm upright. My neck is not forward. My neck is part of my spine, so it stays with the family. It stays with the rest of the spine. You have a wiggle room of the thigh bone inside the socket. A ball and socket joint, so the ball can move inside the socket until it stays there because it hits that socket. Now my obliques have to rotate with the legs, and my knee is going towards the opposite foot. So I'm pushing the ground away. I get to the end of the wiggle room and my oblique will rotate itself so the knee goes to the ground. That was the key. Your oblique has to go to rotate itself. In other words, the socket needs to move itself. The thigh bone, the ball, does not rotate the socket into that position. When it's time to come back, the side of your foot closest to the ground, it starts pressing into the ground and you come back to the center. The socket part and the ball part of the hip joint need to move together. So the socket moves itself, the ball moves itself until the pelvis is on the ground, and now the ball wiggles back to where it was. So I'm going to show you the other side. This time I'm going to show it to you in this angle. So you're going to spread your feet and knee goes towards let me move back a little bit. Is this better? So like so, I'm going to wiggle and then move the socket with the ball as the knee goes to the ground. You are going to feel a stretch here. Remember, you're not rotating your top to rotate the socket. You're not rotating at the mid-back connected to the lumbar. The initiation has to start from here. What I'm doing here is I'm allowing every part of your body involved to do its part. So that means your obliques are in charge of the socket. Therefore, this is a ball and socket joint we're working on. So the obliques have to say, let's go, not the upper back. That's dysfunction. So that is seated supported hip internal external rotation. There's a video on biological breathing at the end. There's a video on toe tapping that we're going to put at the end of this. Make sure you subscribe to the channel. If you have chronic groin pain and you need help with it, if you have or you suspect having dysfunctional patterns of movement feeding your chronic condition, contact my office. I only see patients with chronic conditions, and I only see patients with chronic conditions who have tried so many different things and they're wondering if they will ever be fixed. Your body is here to serve you until the last breath. Provide the environment it needs so it can show you the talent it has. Thank you so much for watching, and until next time, take care.